And off the top tonight, doctors at Baptist Hospital here in Beaumont say there's no reason for any of us to worry. They are waiting to hear whether a man at that hospital has the coronavirus.
So he traveled through China and had a layover in Beijing. He showed up at the hospital Tuesday night showing flu-like symptoms. Tests from the CDC should be back in the next day or so.
12 News reporter Tyler Sagerman is live for us tonight outside the hospital here in Beaumont. And Tyler, at this point, business as usual there, right?
Yeah, Jordan, that is correct. In fact, last week I saw firsthand what doctors would do inside Baptist Hospital if a patient were to come in showing signs with what is associated as the coronavirus. Now that plan is in motion after a man that came in last night with flu-like symptoms.
He is a good sport about the whole process. He looks very good. He doesn't exhibit any symptoms now. He is just watching TV.
Dr. Ollie Osman at Baptist Hospital in Beaumont says the man being tested for coronavirus is in good spirits. He says staff here are trained for situations like these.
Been through Ebola, we have been to H1N1 through H1N1 virus. We have seen these kind of scenarios before.
The patient is being tested for coronavirus after coming in Tuesday night with flu-like symptoms.
We'd already had plans in place and we just operated with our protocols and put him in a room and, like he was saying, went along business as usual.
Last week, ER coordinator Sarah Morris showed 12 News what a negative pressure room is.
Our negative pressure rooms have a venting system called a negative pressure system to prevent the spread of the infection into the hospital.
This is where the man is being held.
They also have a communication box and window so we can communicate and monitor the patient without entering the room over and over.
Doctors took a blood sample and sent it to the CDC. Results are expected to come back within the next 24 to 48 hours.
There is no confirmed case of coronavirus at Baptist Hospital.
Baptist Hospital has continued to operate as normal, and doctors stress there is no need for concern. Again, this man's tests have not come back just yet. Live in Beaumont, Tyler Segerman, 12 News.
So now we want to hear from you all. How do you feel about this with the patient being tested in Beaumont? How concerned are you about the coronavirus? You can vote on our app, and right now, most of you, well, not most of you, it's a 50-50 split almost,
Okay.
right down the middle.
Kind of down the middle.
Yeah.
You give us a 5 out of 10, so moderately concerned. We'll keep an eye on that for you. Again, you can vote on our app. You know, Dej, there's a lot of misinformation being shared about the coronavirus, and tonight we want to answer some of the most common questions we're getting.
It's all about facts, not fear. 12 News reporter Victoria DeLeon continues our team coverage.
Well, we want to make sure you're well informed when it comes to the coronavirus so you can tell the facts from fiction. First, what is the coronavirus? The CDC says the new 2019 coronavirus is a respiratory virus that first showed up in Wuhan, China. It looks like the common cold. Now, you may have a fever, dry cough, and find it hard to breathe. In order to get the coronavirus, you have to come in close contact with someone who already has it. Which brings us to our second question. How does the virus spread? According to the CDC, the virus probably originated from an animal, but now it's spreading from person to person through coughing and sneezing. And you have to get pretty close, 6 feet to be exact, according to the CDC. 3, how is someone tested for this virus? Well, doctors need your blood. Then they send it off to the CDC. And then it takes about a day or two to get those test results back. Until then, the patient will continue to be isolated. 4, there's a rumor going around that Lysol and other disinfectants kill the infection. This is not true. There are 6 strains for the virus, and some of these work on the other strains, but not the 2019 strain that's affecting people. Now let's break down some numbers. There are confirmed cases in 28 countries, 11 of those right here in America. 206 tests have been negative, and the good news, no one has tested positive in Texas. Since there is someone being tested for the virus right here in Southeast Texas, it's easy to start worrying. But Baptist Health tells us all protocols were followed and that the patient was isolated. The Beaumont Public Health Department says there is currently no risk to the community. Remember, this isn't the time to panic. Instead, it's important to stay updated and informed as health officials continue to learn about the virus. Victoria DeLeon, 12 News.